welcome to Annotated Medical Tutorials. Today I want to talk about tooth decay and how you can treat it or how you can manage it when you're at home, and also the treatment options that you can choose whenever you go to your dentist. So one thing that you need to know is that tooth decay is not something that can occur overnight. It's actually something that occurs over months and years. So I want to take a quick look at the stages of tooth decay and the treatment options that are available for each and every stage. So before we do that, we need to take a quick look at the normal structure of a tooth, and then we discuss it. So a normal tooth consists of a crown and the roots. Here you can see this white layer is called the enamel, and this is the hardest substance inside the body. The bone is not even as hard as enamel. And then below it we have got this yellowish substance. This is called dentin. And dentin is the second hardest substance in the body. Inside it, there are some nerves which sense what's going on around your tooth. And then below the dentin, we have got a pulp. The pulp contains some nerves and blood vessels which supply nutrients to the tooth. Another point that I need to emphasize on is inside the mouth there are bacteria which we live in harmony with, and we call them microflora. But these bacteria tend to multiply whenever there is surplus amount of food for a long time. For example, if someone does not brush their teeth, the food will be available for a longer time to the bacteria, so that the bacteria can multiply on the food, and then they feed on the food and release their products or the waste products which are acidic. And these waste products begin to erode the enamel slowly over time, and then causing tooth decay. For this normal tooth structure, I want you to notice the black dots here. These are the initial stages of dental decay. And usually people don't even notice it, and they are not even aware of what's happening to their teeth. But these are the stages in which, if you go to your dentist, they will diagnose this and then treat it as early as possible. So this initial stage of tooth decay is asymptomatic. There are no symptoms whatsoever. So unless you go to the dentist, you won't be able to diagnose that decay is already started. So if not treated, the decay will then progress further down into the dentin, and this is the stage when the patient begins to notice some symptoms. And the symptoms include sensitivity of the tooth to cold temperatures, and also sensitivity to sweet stuff. So whenever you put something cold to the tooth, it becomes painful, and as soon as you remove the cold stuff, it becomes normal. Whenever you put something sweet, it becomes painful, and when you remove it, it becomes normal. And this stage is very important in the fact that this is the stage where you can get a tooth filling. Otherwise, beyond that, you won't be able to get a tooth filling as a treatment option. So if not treated at this stage, the decay will progress from the dentin straight into the pulp. And this is the stage where the tooth becomes so painful to the extent that the patient cannot even sleep. So the treatment option for this tooth is now limited. So that we can only extract it, or we can do what we call root canal treatment. And this one is the most expensive treatment option in this one. So root canal treatment is a procedure in which the infected pulp and the dead pulp is removed from the canals, so that the canals are left empty and they are irrigated with disinfectant and some solution with antibiotic properties. So those canals are then filled with special material that does not allow any growth of bacteria, and then the tooth is then rebuilt again using material like composite, which is tooth-like in structure, and then the tooth will be able to continue its function as a dead tooth inside the mouth. Now let's take a quick look at the medication that you need to use whenever you've got a painful tooth at home. Any painkiller that works for you is fine, but I need to emphasize the fact that if you want to have a tooth extraction anytime soon, please stay away from anything that contains aspirin. For example, Panadol, Disprin, Cafino, Pain Easy, because aspirin makes your blood very thin and it prolongs the bleeding time after tooth extraction, which is not a desirable thing. So the recommended drugs include paracetamol, diclofenac, ibuprofen or simply brufen, and cocodamol. Thank you for taking your time to watch this video, and if you find it helpful, please consider subscribing to our channel and click the notifications button so that you can be notified when we upload the next video. Goodbye.